Good morning, everyone. My name is Angela Joy Amdalayan from Nueva Ecija University of Science and Technology, BSN 3G, and today I will going to perform the assessment of the 12 cranial nerves return demonstration. For the assessment, first check the doctor's order. Next, check the client's level of consciousness and level of knowledge and understanding. Next, check the availability and functionality of the needed materials. And lastly, we need to assess the mental status or ability to participate in the procedure. For the planning, if possible, determine whether screening or complete neurologic examination is indicated. This will impact the preparation of the client, equipment, and timing. For the preparation of the equipment, we need the whisk of cotton to assess light touch sensation, sterile safety pin or tactile discrimination, sugar, salt, coffee, and soap, tuning fork, tongue depressor, paper clip, pen light, and clean gloves.
So now for the implementation, I will introduce myself and verify the client's identity and explain what I'm going to do and why it's necessary and how he or she can cooperate.
Good morning, ma'am. My name is Angela Joy Amdalayan, student nurse from NDUST, and I will student nurse for today. Can I know your name, ma'am?
Eliza Grace M. De Leon,
And your date of birth?
May 26, 2000.
Okay. And today, I will do an assessment for the 12 cranial nerves. Is that okay to you, ma'am?
Yes.
Thank you. Next, perform hand hygiene. Observe appropriate infection control procedure. Next, provide for clients privacy. Do you have any pain in the neck, back, or extremities?
None.
What about a disorientation in time or place?
None.
Problem in smell, taste, touch, or hearing? Thank you, ma'am, for your answering.
For the first cranial nerve assessment, the first cranial nerve is the olfactory nerve. This is for the sense of smell. So, okay ma'am, and I want you to identify
For the assessment of
this
the cranial
object.
nerve 1, the
Okay,
olfactory.
so close your eyes ma'am.
Ask the client to close their eyes and identify different mild aromas, such as coffee and soap.
What is this? Coffee? Okay, very good. Let's go. Very good, that's great. Okay, I want you to open your eyes and that cranial nerve is intact. For the second cranial nerve, which is the optic nerve, this is for the vision.
So, ma'am, can you stand up and stand right here? Okay, ma'am, do you wear any contact lens or eyeglass? Okay. Okay, ma'am, I want you to read the lowest line
For the cranial
that you can
nerve
read.
2, the optic nerve,
I want you
ask the
to
client to read
cover
the
up
Stellan
your
chart,
right,
check visual
with
field by confirm.
left eye and read what you can see in the Stellan chart.
Number 8, B, E, F, E, O, P, E, C.
And then the other one, the right, cover up and read that.
Number 8, B, E, F, E, O, P, E, C.
Okay, thank you, ma'am. To stare my eyes and don't look to my fingers. And I want you to sabihin mo kung ano yung numbers na makikita mo sa up and down. Okay? Okay. 2. Okay. 3. Okay. Then the next one. Then identify how many is this? 3. How about 3? 3. Okay, very good. Thank you, ma'am. For the oculomotor, we will test for the patient's for lack or the pupils are round and equal and reactive to light. For the cranial nerve 3, the optical, we need to check for the perla, pupil reaction. For the cranial nerve 4 and 6, the trochlear, assess 6 ocular movements. Fifth cranial nerve, which is the trigeminal. For the cranial nerve 5, the trigeminal nerve, while the client looks upward, lightly touch the lateral sclera of the eye to elicit blink reflex. Thank you. Yung huyak nga. Oh, huyak. Ayan, sige. Okay. To test light sensation, have the client close their eyes and wipe a whisk of cotton over the client's forehead and for a nasal sinuses. To test deep sensation, use alternating blunt and sharp ends of a safety pin over the same area. Seventh cranial nerve, which is the facial nerve. Okay, ma'am. Can you please smile? For the cranial nerve 7, the facial nerve, ask the client to smile, raise the eyebrow, frown, pop out cheeks, and close eyes tightly. Ask the client to identify various tastes placed on the tip and slide of the tongue, like sugar and salt, and identify areas of taste. Nerve 8, which is the vestibulocochlear. It is for hearing and balance. This test, we will do a Ryan's test and Weber's test. Also, a whisper test. Okay, ma'am, I will cover your right ear and I will whisper something and I want you to repeat what I say, okay? Hapon. Okay, very good. The other. Banana. Okay, very good. Next, we will do a Weber's test and Ryan's test. I will use this tuning fork and I want you to set if the sound is stuck, okay? Stop. 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 Thanks for the balance. Now I want you to stand right here. And I want you to walk from here to there. Okay. Turn around. Come. Thank you. You can sit now. The glossopharyngeal nerve. Apply this on the posterior tongue for identification. And test for gag reflex. Cranial nerve 10, the vagus nerve, assess the client's speech for hoarseness. Cranial nerve, which is the accessory nerve. For the cranial, 11. The accessory. Ask the client to shrug shoulders against resistance from your hand and turn head to the side against resistance from your hand. Read for the other side. Next, the last cranial nerve, which is the hypoglossal. This is a test for the tongue movement. Okay, ma'am, I want you to include your tongue. And the last, the cranial number 12, which is the hypoglossal nerve.
Left, right, and left.
Ask the client to protrude tongue at midline, then move it from side to side.
Cranial nerve assessment.
And for the evaluation, evaluate the patient's response to the procedure. And lastly, document the procedure and other important data on the client's charts. And this is for today's video. Thank you and God bless.